Hi, my name is Angela Campbell. I'm a postdoctoral fellow at the Indiana University School of Medicine, and today I'll be discussing my paper, Pharmacologic Therapy Among Opioid-Exposed Infants, Disparities by Race. So our main finding is that Black infants have reduced odds of receiving pharmacological treatment for neonatal abstinence syndrome relative to white infants. Neonatal abstinence syndrome is a cluster of symptoms that occur when an infant is born addicted to opioids due to exposure to opioids in utero. This finding aligns with previous findings that Black patients are less likely to receive treatment for pain relative to white patients. And we did a little more digging into the data, and we believe part of the disparity may be due to fewer Black mothers who are using opioids being identified during their pregnancy relative to white mothers. So in order to conduct our analysis, we have a sample of opioid-exposed infants obtained from a large metropolitan hospital. Exposure was defined as an ICD code for neonatal abstinence syndrome or opioid exposure in the infant's chart, or an ICD code for opioid use during the 9 months of pregnancy in the mother's chart. Logistic regression models were adjusted for insurance status, gender, year of treatment, and facility. The full model finds that Black infants had a 77% reduction in the odds of receiving pharmacologic therapy relative to white infants. So these results suggest that racial disparities in symptom management begin at birth, and they may be partially due to intergenerational transmission of disadvantage. New trends in NAS management are moving away from pharmacological therapy and into more intervention-style treatments with swaddling, breastfeeding, and skin-to-skin contact. But as we move into this new form of treatment, it's important that we monitor this transition to ensure that it is equally given to all infants based on symptomology. Our clinical recommendations are increased education regarding racial biases in prescribing practices, as well as increased efforts to standardize the care and treatment of opioid-exposed infants. Thank you.